And yes, tonight you can expect pictures to start surfacing of more than 200 iconic landmarks illuminated in green, teal, and pink for Metastatic Breast Cancer Awareness Day. The virtual benefit kicks off at 8. There will be celebrity guests, including Matthew Knowles, Miranda McKeon, and other actors. The colors each have their different meanings, so check this out. Green stands for renewal, hope, and immortality. Teal for healing and spirituality. And pink, the metastatic cancer originated in the breast. With that, Dr. Salim Surani joins us live to discuss metastatic breast cancer. Dr. Surani, you've been in the medical field for quite some time. So what do you see when it comes to fighting this disease? Are we slowing things down? We've seen, and we reported recently, the rates of deaths from breast cancer has significantly dropped, but it seems like more and more women are being diagnosed.
Good morning, John Thomas. Glad to be here. And thanks for doing this story. It's very touching. And you know, one of the key things is that we don't need to get to that point. If you look at it, every 2 minutes, one woman in this country are being diagnosed with a breast cancer. The key thing is, if we can diagnose it early, we can prevent this deadly disease. And good thing is 3.8 million people are surviving the breast cancer in this country. So if you look at it, almost 280,000 people in this country are being diagnosed with invasive breast cancer and 50,000 with a non-invasive breast cancer. That's a huge number. But the good thing is the prevention is the key thing. And if we can work on screening tests, if we can watch our symptoms, if we can create the more awareness as we are doing, we never have to come to a point where we are looking at the metastatic cancer. And if we look at the data, 65% of the patients are diagnosed in the early stage, and there are 99.9% of them can be cured. So I think the key message is the prevention is the key thing. If we can understand what the symptoms are, if we can understand what the screening are, and if we understand what are the barriers to the screening. And I think that is one of the biggest things which we need to address. What are the key barriers and how we can overcome the barriers, and we can prevent this disease, which is kind of preventable. And if you know, even if you get it detected early, 65% of them can be almost cured.
Well, Dr. Surani, Sarah had mentioned in the story there that if you know somebody, if you have somebody in your family that's died from breast cancer, there's a 98% chance that it was metastatic.
That is very true. If you look at what are the risk factors of the breast cancer, any family member who have a breast cancer, if you have a BRCA1, BRCA2 gene, you have a high risk of the breast cancer. If you have personal history of any cancer or radiation, you have an increased risk. If you drink alcohol, you are at increased risk. There are certain things which are preventable. Obesity. If you exercise and regular in your exercise and you prevent gaining weight, that helps in prevention of the cancer. If you are kind of on a hormonal therapy in the menopause, if you kind of cut back or avoid it, that decreases the risk of breast cancer. If you do the screening, that decreases the risk of breast cancer. And some of the other factors, if you pay attention, and if you have any family member who have a positive BRCA, you want to get it checked, and if you have it, you need to address it right there.
Okay, Dr. Surani, we have a lot more to discuss on this. We're so happy that you're here with us to kind of go more in depth with the technical terms and the medical knowledge there. So you will be joining us in the next half hour. If you have a question about this topic, we are talking about metastatic breast cancer and how this is Awareness Day for that across the nation. Just send us a text at 361-855-6397.